session. I would request the chairperson to unmute and switch on the camera, starting with Dr. Yogesh C. Shah. Over to you, sir.
Thank you, Ishab. Good afternoon, everybody. I take this opportunity in the beginning to thank the team of All India Ophthalmic Society, especially our Secretary, Dr. Namrata, President Dr. Maipal, and incoming President Dr. B.K. Nayak. I think it has been a great opportunity for all of us to have this new experience of having our national conference, a prestigious conference, as online conference for the first time in the history of AIOS. In this instruction course, we will have excellent speakers. To begin with, Dr. Senthil will be starting. Dr. Senthil is a leading consultant from Chennai, and I'm sure most of us know him because he is the one who started the Opthal Practice Group, which has diversified into multiple advantages for all the members of AIOS in view of learning, in view of settling the practice, in view of learning how to manage your practice, buying, shopping of the equipment, selling of the equipment, and so on and so forth. Next speaker on the list, I will be talking about footfall. Then will be Dr. Debash Bhattacharya. I'm sure nobody needs introduction for Debash, a great towering personality from Disha Eye Hospital. He is obviously, as you know, past president of All India Ophthalmological Society as well. And I had an excellent opportunity to work with him as a treasurer of AIOS during his presidency. He will be talking to us about the management of HR, about the incentives and how to give the increment to the staff of your institution. After that, we will have Dr. Gaurav Shah, who will be talking on the maintenance, consumables, and controlling the outgoings. Dr. Gaurav Shah is a retina consultant at Netra Mandir and is also a chairman and retina consultant at iLife Hospital in Khar, Santa Cruz, Mumbai. Dr. Gaurav Shah has done his basic training from Shankar Netralaya, and then he was at LV Prasad Eye Institute and also did second fellowship in USA in America from Gainesville or Florida Society, Florida University. To his credit, he has a lot of training from business management. He did his courses in business management in Bombay, and I'm sure he will give justice to this particular topic given to him. After that, we have two speakers, Dr. Vivek Dave and Dr. Tarjani Dave. Dr. Vivek Dave unfortunately may not be able to join us because he has already been selected for the Rangachari Award session, which is also running simultaneously. But Dr. Tarjani will take care of his topics. Dr. Vivek Dave is a retina consultant at LV Prasad Eye Institute and has done a great job both nationally as well as internationally. He has been active in leadership development programs of Asia Pacific Society as well. Dr. Tarjani Dave is an oculoplastic consultant at LV Prasad Eye Institute, and she has really been very active of late during this COVID situation in the management of mucormycosis. Probably she is one of the person who has been advocating and participating in large number of conferences all over India as well as in the international group. Her publications have already gone through in international societies about mucormycosis. Both of them being at LV Prasad, and as we know, it's a tough job for both husband and wife to be at LV Prasad. And the topics which are given to them are relevant economic and academic growth, which she will cover, as well as she will also cover the topic for balance between the personal and the academic life given to Dr. Vivek Dave. With this, may I request Senthil, you are already there. Can you start your first topic?
Yes, sir.
starting, expanding the practice, and maybe in a short you will cover how to do the propaganda.
So is my screen visible? Are you seeing my
Yes,
screen?
yes, it is visible, Senthil.
So thank you, Dr. Yogesh, for this nice introduction and opportunity to talk in this instruction course. I think I would set the tone for today's instruction course because there are going to be interesting topics which will follow by Dr. Debash and others. So I think starting and expanding a practice. So starting a practice itself is how many of the ophthalmologists who are completed recently are thinking of starting a practice. There is a huge question mark. So because starting a practice is too challenging these days. It's not like the olden days when we start a practice with a small investment, but these days the ophthalmologists are facing a huge challenge, and there are too many questions in the mind of an young ophthalmologist about starting the practice. And the topic given to me is on the 3 P's, like place, purchase, and publicity. I would also cover on what are the common questions which an young ophthalmologist may have, and then talk about this topic. The first question which any young ophthalmologist will have is, when should I start? Should I get, after my PG, should I start right away, or should I get trained, or should I do a fellowship, or should I be working with somebody to start before I gain the knowledge and everything? I think the right time to start is now, as soon as you finish, because as you all know, this MBBS and PG and this fellowship, all this education itself takes a huge time, like at least 13 years of our life. And if you are somebody who thinks, who wants to do a private practice, I think the right time to start is now. With a decent surgical skill, because I think phaco you have to learn, and one thing before you start is maybe you have to learn the nuances of the private practice. So before you start, maybe you work with a private practitioner, a corporate hospital, or a private practitioner to know what is a private practice, and then you start. So basic education, the MS ophthalmology or your fellowship, and then confidence in doing those basic surgeries, at least like phaco and all those things. And then more important is the confidence to do a private practice, because there are lots of nuances. Starting a private practice is not that simple. You have to learn how to convince a patient, learn how to do some HR management. So that experience you will gain working in a corporate hospital or with a private practitioner. I think you should learn that for say 1 year, and then that's the right time to start. Mostly we were having a discussion with Dr. Debash also, like most of the time the doctors start at say 35 to 38, 39. That's the time when many of the practitioners start the practice. But I think as soon as you're ready, you should start. So the next common question is, should I start a full-time practice or a part-time practice? Can I work somewhere in the morning and then can I do a practice in the evening? But because now these corporate hospitals, they have set a very good standard for an eye hospital, and the patient comes to the hospital with an expectation. So I feel a full-time practice is viewed more seriously by the patient than a part-time practice. So it's always better to start a full-time practice. I do agree that there are challenges of finances and monthly survival income and all those things, but definitely a full-time practitioner is seen as a more serious practitioner than a part-time practitioner. So maybe once you have this enough experience, it's better to always be a full-time practitioner. Initially, it will be demanding. You don't have too many patients, too many surgeries happening, but as you go ahead, I think full-time practice is going to be more fruitful. And the other common question is, should I start small? Can I start a small clinic and then can I expand it into a hospital? But now a patient who wants to have a cataract surgery or a basic procedure comes with the expectation of an eye hospital. He knows that an eye hospital will have a reception with so many staff with uniforms, and then you have those ambience and OT and at least basic facilities available. So basically starting as a small clinic and then expanding into an eye hospital may not work these days. So at least a very decent 2,000, 3,000 square feet setup with the OT is what is recommended if you're looking at a long time serious private practice. And again, I understand that there are challenges in financing and all those things, but gone are those days when you start a small clinic and then expand it. I would suggest that look at a decent sized hospital when you are going to start. And how much do I need? I think that's the big question which we have in private practice. So I think to start this kind of a practice with your own OT and 3,000 square feet space, at least investment of 70 lakhs to 1 crore is what is required. But definitely it's going to be fruitful. I'm sure it's going to get back the money which you've invested if you identify the right place and start the practice. So though it might look huge and maybe the individual practitioner doesn't want to take that risk initially, but definitely if you have the right place, I think this budget you can recover it at no time. So the next question will be, where will I get the money? So all of us are not born rich to invest that 70 lakhs or 1 crore. So maybe if we have that, it's good. The common source of funding is our family and friends. So maybe you try to get that money from the family or friend. A bank loan is a good option if you can give a collateral. Now lots of banks are offering loans even without collaterals. Getting an investor is a good idea, but basically, I would say in your initial stages, an investor may not have the same potential and appetite as you. So basically, having a non-ophthalmologist investor might not be an advisable thing. More focus is now going towards a group practice. Rather than starting as a single practitioner, maybe if 3 of the juniors can join together and start a group practice, I think there is nothing like that. And the financial commitment is also less when you start a group practice. So better to go as a group. I think this is where you can get the money for your practice. The next question is whether I should start in a city or a town or a village. I think now the potentials are in the towns. So cities are already populated. There are so many competition from ophthalmologists, corporate hospitals, charitable hospitals. Better to go to smaller towns. I think there is a huge opportunity now in the tier 2 kind of towns, not in the tier 1 towns, but tier 2 towns. People are spending power. I also learned that from the equipment companies that most of the ophthalmologists to purchase these larger equipments are now coming from the smaller towns and tier 2 kind of towns. It's not the ophthalmologists in the city who are buying those expensive equipment, meaning there is a huge revenue potential in the smaller towns. So identify those towns which are closer to you and then start your practice. And I think everything is about the location. So where do you start your practice? So maybe, as I said, do it in a place where the competition is less and people don't have any other option for eye care. The population demographics, you can actually understand that where to start is basically from these big retailers like Reliance, Trends, or all those big jewelry chains. Open up shop in a particular tier 2 town. I think they do enough market research for you. So that is the place where you should start. So you don't have to spend money on the market research. And identify the traffic patterns in that particular location, if that is accessible to you, to the patients, it's near the bus stand, all those things, whether it's near the railway station. You have to identify a location which is that way. And paying capacity, are there any industries where people get employment in those localities? Or there are rich farming communities. You start your practice in those kind of places, and whether you can put up good signages, because initially most of the patients are going to be walk-ins, and all these factors I think you have to consider for the location. And another thing is, what all should I purchase? Because there are so many instruments available. I think initially you should go for the basic instrumentation. Don't have to buy an OCT at the start of your practice. So once you attain that potential to reach a particular number of patients, that is when you start expanding. But ophthalmology practice cannot be done minimally also. You need at least the basic instruments like the autorefractor, good quality slit lamps, reasonable surgical microscope, phaco machine, all those things. And you start with them. Another option is to buy them in bulk purchase, or you can buy them as a group, or you can even look at second-hand instruments to start off with. So the final slide is how do I get those patients? I think Dr. Yogesh will be talking in more detail about that. But initially, as a small practitioner, I think you should focus more on public relationship. You should understand what is the difference between advertising and public relations. So public relation is all those things. Advertising is you go and tell the patient, I'm the best, you come to me. That's not the way, because in healthcare, advertising doesn't work because patient gets suspicious. So what you have to do is focus more on the PR skills, more on public relation, do some community activities, maybe eye screening camps, awareness programs. Let the local media write about your hospital. If you have treated a particular patient who has got a special condition, those are the activities. Be part of those Lions Club and organizations. Talk to people. I think become a local celebrity. That is what all those public activities for you. I think my time is up, and thank you. And if you are really interested about the practice development, you can get into our website, and these are my contact information if you want to have any other questions with me.
Thank you, Senthil.
Yeah.
Thank you very much, Senthil. Can I share my slides if you can stop?
Yeah.
Thank you. Senthil, you covered it up very well, and part of it, in any case, I'm going to cover right now. We will start with my topic on footfalls, how to increase your footfall. Right, show. Okay, can you see my slides, please?
Yes, sir, we can see.
Yes. Okay, fine. I think Senthil has made my job relatively little easy. He has already covered in last 2 or 3 slides about the publicity. I'll take up from there and continue to move forwards. And as we understand, this is one topic which can take hours and hours to discuss, and still the time might fall short. So having understood that, we'll try to cover up the basic important points. And one thing which he has already covered, will the urban or the rural area make some difference? Yes, it will certainly make some difference depending upon the place and the application of the practice that you are going to start with. But it will also vary from a solo practice to the group practice or the corporate practice or institutional practice. I will try and deal with some of the salient points and take home away messages as far as possible in this connection, in this particular topic. Right. Now, the first thing I think everyone has to understand that all these years, maybe barring the last 1 or 2 decades, we had been dependent only on the mouth-to-mouth publicity. And there have been questions which are raised. Is it slow? Is it outdated? Maybe possibly it is still slow, but I still rate mouth-to-mouth publicity as one of the most important factors in increasing the footfall. What I really believe that some innovation in mouth-to-mouth publicity is required, like make a happy patient your brand ambassador, or you make a group of patients like LASIK alumni, and they themselves will interact with each other, and they can be the people who will propagate your center to the other patients as well, which will certainly be a more valid factor for increasing your footfall. Electronic media comes next today, though we all understand that barring refractive practice, our major practice is a geriatric practice. But the role of younger generation in the family cannot be ruled out today. They all search on internet and Google search. There are ways in which you can prioritize yourself, make an important person yourself on the Google search or on internet by payment, and that will possibly add to your publicity. Website, you need to update on a regular interval and see to it that it is most updated website, because they invariably visit your website. You can put plenty of testimonials from your patients, because that is something which is always looked for, and the starring that they have given, the amount of value that they have given to your institution and your treatment does carry a point for the person who is coming down to you for the first time. With the consent of a patient, happy patient, maybe you can even share their contact details on such a group, so that one-to-one interaction will help the new patient to come to you. It is easy to upload your videos today, either on the YouTube or on your giving a link on your website, and they should be easy to understand videos. All recent activities that you are conducting can also be displayed over there. Senthil has already touched upon the social groups like Rotary, Lions, Giants Club, and so many NGOs, especially in the city levels and metropolitan cities. I think for a beginner, it is important to join such groups and start their practice at a separate place, primarily because that gives you wider exposure, as well as you remain in contact with many other ophthalmologists who can also help you and guide you. Other medical fraternity who enter into full body checkup, you can also participate along with them. So that way you can always have patients from the other branches of medicine as well. I think eye bank and eye donation awareness lectures is one of the very important thing which you can always utilize, so that you can spread yourself, make yourself known to large number of people by these such lectures. It's also important, we have tried it in our this thing, that when we take such a lecture, we request them to have our numbers handy, giving them kind of a small sticker of your address or a business card, which they can paste either on the notice board of the society or in their own home at a place. Because in emergency, most of the time, new patients don't find your telephone number. So this is one way which you can propagate yourself and which is ethical. I think newspaper also has got a role to play in today's scenario, but we will distribute it in three different ways. One thing, as far as the newspaper is concerned, is you can write columns in the newspaper if you have an access to that particular thing. Announcing the events like World Health Day and kind of a publicity that you would like to derive from it can also be done almost free of cost in the newspapers. A leaflet given in the newspaper in a local area has got immediate response, and usually you recover more money than what you have spent in such advertisements. You need to analyze very well that which leaflet has given you a best result, and next time onwards you can try and propagate that particular newspaper in that localized area. However, the advertising itself, direct advertising itself in the newspaper is really an expensive affair. Unless and until you have multiple hospitals and multiple cities where you are practicing, such thing may not be very productive. But in any case, if you have multiple centers, then possibly this is also one of the ways in which you can go ahead. There have been dispute over the free camps. As we understand, there are people who say that there cannot be a free camp, there can be a free camp. But I believe that a free camp also can be sponsored by somebody. And for a beginner, this might be a good option to create the footfall for him. You need to select the area where there is a deficient service. Sporadic camp, in my opinion, may not help much. But if you are regularly making a camp in one localized area, that possibly will give you a recognition in that particular area, and you will be able to make a good usage of that particular event. You will have follow-up of the patients, you will have new patients coming from there. Just important note, take care not to affect the practice of your colleagues. Should you have free OPD? I think one can have a free OPD in the same premises only on one day. You can allot that. But my belief is that subsidized OPD can totally replace the free OPD in today's scenario. One has to evaluate its worth in today's scenario for sure. We often attend charitable clinics run by the NGOs. Here we are almost giving our free service, earning a peanut amount from the institution. Why not do it in our own clinic? At least we will be able to have the goodwill and the benefits of that particular practice allotted to us and not going to that NGO or that institution. A vision center is a very, very good option to propagate yourself. You just need about a 1 lakh rupee investment. You can have a free place as well. Like, for example, Saturdays and Sundays schools are off. You can request a local school to give you a hall for about a year, for about an hour or so. The staff needed is also relatively low. You need one trained optometrist and a good counselor. It is almost like a telemedication, which we are of late practicing due to the COVID situation. This can help to improve the quality of the footfall, because all the people who need minor things like refraction are taken care at the vision center, and the surgical work can come, so you can concentrate more on that. Attachments with services like Procto, Just Dial, etc. I think in a beginning it is group, but eventually they also start dictating their terms on you. Public education lectures and fellowship training programs are really, really very good options. So various schemes which people have been trying to allocate is to free checkup for the relatives of a premium surgery patient. Also, there are family benefit schemes like the disorders like glaucoma, myopia, hereditary disorders, retinitis pigmentosa, and so on are in family. You can always propagate seeing one patient to request him that your family can be checked up at a concessional rate or some such thing. However, there is a warning by me: don't stoop down to the level of buy one, get one free. These fellowship programs, if we see over here, then you have a teacher. What you need possibly by training programs and fellowship program is only the teacher, either for the optometrist or a ophthalmologist who can teach the students. Those students will make a good HR force for you for various activities like Vision Center and like other charitable activities or a semi-charitable activity which you will do. That will create a surgical workload for you, which is either free or a subsidized. That surgical workload can help you for fellowship training. Yes, I'll just take a half a minute. And such educational research activities can be done because you have mass number of patients over here, which will allow you to have either the research activity or the educational activity, which itself will support these teachers. That is the way you can probably go on in this particular way. And that is my last slide. To summarize, select what is applicable in your practice. Proper audit will tell you what works best in your hand. Modifications will be required as you grow on, and as you grow, more and more innovative ideas will come once you grow, and your modality to propagate yourself will also change. World has become very competitive. Corporate sectors are rapidly growing. We will have to change with the changing time, especially right now in Corona effect. We have already learned and we have already developed our new normals. So that is something which we have to understand. And lastly, the survival of the fittest is the best policy that we need to understand. Thank you very much for your kind attention. Hello. With this, I think we will take up the questions a little later. Can I request Debash sir? Dr. Debash, as I said, yes, sir, your slides are there. Dr. Debash, our past president of All India Ophthalmological Society, and from Disha High Hospital, chairman, as well as someone who initiated the entire system of Disha High Hospital. I think there is a lot to learn from Dr. Debash. Sir, over to you.
Thank you, Yogesh. You gave me my wife's topic, so I am on a tight spot. But anyway, I'll try to justify as much as I can.
Sir, behind every successful man, there is a lady, and she is your wife. I am very happy.
Yeah, the essential part of the joke to start with was actually we have more of lady staff, and so naturally they are more comfortable under a lady supervision. So that is how it has evolved over years. So essentially, HR is perhaps the most important component because the patients, if they spend 2 hours in the hospital, 150 minutes are spent with the staff. So they must understand the goals of the hospital very clearly. And our goals very simple: a fair priced quality eye hospital. That is what we are. And we try to attend everybody's aspiration, respecting their ability to pay. So we have to work hard, because that's the only thing we can do, and assimilate as much technology and systems so that it can come to, the costs can be broke even in economies of scale. So essentially what works in Disha so far as the HR perspective is concerned is the ownership of doctors, because here the entire strategy is done from a very doctor point of view, because the strategy means the choices that we make, the pricing that we do, the ultimate end product that we pass on to our patients. They're all doctor driven. And the second thing is we assimilate a lot of technology, systems, data, because now we are a big organization. We have more than 850 staff. We have 100 doctors. So essentially, we have to capture data at every point, because, it is good that there's a Queen's Justice, as they call it in our hospital with my wife. But, if she talks based on data, that makes much more sense. Or when an intermediate hierarchy talks to the lower order in the hierarchy, if they talk on data, the conversation becomes very rational. So definitely evolve data systems at every point to where, however small or big your practice is. So it helps you in the long run. When you extrapolate data, you get a lot of important information. And obviously, it is of the order that we don't hire very high profile people. So essentially, the seniors train the juniors, and that's how it goes. And the entire supervision, as I said, is mostly data driven. So this is a very simple, flat organization where I sit, I'm somehow allowed to sit there. And then we have the three arms, Director HR, Director Admin, Director Quality Assurance. And then each center, we have 15 centers, which has a doctor center head. And then we have a centralized control in our main hospital in Barakpur, from where we control the entire proceedings of all the arms of HR. So in every small setup also, you will probably find, or there is multitasking at various levels, but you'll find one person responsible for each of these tasks. And multitasking is definitely important, because we keep one person in each branch, or two persons who can do almost anything in that hospital. So these are very useful people, and I'll tell how we come up through the order. So the recruitment age, because we are almost going to the 25th year, so we recruit young people. 25 to 27, graduation has become mandatory except for menial jobs. We train them over a period of 6 months to 1 year. Collateral entries usually are only restricted because they are mostly job hoppers. And it fits into somebody's culture, but it doesn't go with our environment. Everybody has their own HR ecosystem. Nearer to home preferences are given because they become more productive. Need is considered as a basic consideration. If you find higher order people, they will hop more. Need is required because if they need the job, they'll work harder, their passion to the job would be more. And all that you have to see is to regulate these people's lives, because they sometimes, jump the order to, achieve too much more, whether they are taking loans, etc., etc. These are little things that my wife looks into. So all statutory things are done, and creating an emotional staff infrastructure, which is through celebrations and birthdays of children, giving them gifts, etc. And there has to be a redundancy and pipeline, because people will leave, and redundancy because the demand is also not equal at all times. So we promote collective work, and that is how at the 4th year of a center, you can understand that this is going to be the growth in the 4th year. So then the projections are made, and anything that is done above the top line, above the projected top line, 5% of that goes to the staff. Usually our staff expenses are around 10%. Doctors' expenses are 20%. Now, to promote individual performance, as I said, like the telephone appointments, the appointment costs us 17 rupees per, and one caller takes up about around 60, I think it's 58 appointments a day. So if they do 70 appointments, then her cost comes down. So we give 50% of the extra work that she has done as a bonus at the end of every month. So this stimulates. And the staff training programs, these are all separate. For this, they get their special roles, they get it, and we talk to them and we consider them. And obviously, these things are very strongly considered. Now, let us come to the more difficult aspect, because everybody wants happy patients, but who's going to give happy patients? Happy doctors. We need to have happy doctors. How do we have it? Because, doctors, of course, they work for, the kick and everything, but they also work for money. We must appreciate that. Because if we have a totally incentive-driven system, then, there will be too much competitive atmosphere, but with only salary, then there is complacency and people feel demotivated. So a salary of an incentive starts at the end of 3 years, and it goes at the entry level. This is what it is. Now let me explain the incentive structure. This is how we pay for the OPD. You can have a snapshot because time is very short, and I'm rather getting into the nitty-gritties. So incentives are calculated on a yearly basis. We don't make it monthly because otherwise there's too much noise. And this also forms the structure for increment. And surgical incentives for SICS, it is 800, 500, so that is 1300. Advice is separate. If a surgeon is only doing OPD, they can earn from the advice itself. And similarly, for phaco, it is 1200, for topical, 500 extra, and for advice, 1000 rupees. For torics and trifocal, there is an additional thing. So this is how it goes for retina, injections, LASIK. Now there's an attendance incentive, which is calculated as 2000 hours per year, and anything above that gets incentivized or deducted. There are academic incentives also. We pay very, rather award very heavily for academic achievements. So the compliance ratio is another thing, that how much did I order, how much did I advise, because people get trigger happy in this system. So then if you have done better in compliance by 10%, you get 10% of the total value more. So another concept that we have introduced is the brand value. That is, after 10 years of employment, the doctor gets a fair feedback of his brand, and a brand doctor gets 40% more of the procedure, but sees only his patients and nobody from outside. And that is how, when the doctor usually tries to move out by age of 40, where he has created a brand, we prevent that by compensating him more. So that's how it works. So these are the compliance ratios, and This is the ultimate thing, why people work. Yes, I'll just conclude. It's mainly for social needs. That's how up to where the staff work, the doctors. It's not only that, we have to take care of their self-esteem and their academic needs, their professional content and everything. It's not only about money, but definitely money forms a very integral part of the whole thing. Thank you very much. We will take up questions as they come.
Yes, thank you, Debashish ji. We will have some questions time permitting. And your last slide, I think Dr. Tarjadi possibly will touch upon it in her talk. So our next speaker, Dr. Gaurav Shah, can I request Gaurav to share his slides? And sir, your slides, if you can cut off, Gaurav can share his slides. Okay, right. So there we have Dr. Gaurav Shah, who is the retina consultant at Netra Mandir Eye Hospital, as well as he is the chairman and director of iLife Institute at Khar. And he has got to his credit training in the business management as well, and has done his retina fellowships from LV Prasad as well as from the University of Florida in United States of America. Go ahead, Dr. Gaurav Shah.
Hi, good morning, everyone. And we'll quickly jump on to the topic here so that we don't have to waste time. Let me see how. So let's talk about ongoing maintenance. Why is it really important to discuss ongoing maintenance? Because if one wants to grow in practice, then growth can happen only over a solid foundation, and hence the need to maintain or strengthen whatever is currently existing. What all do we have to maintain? Everything, right from the infrastructure which we have created, our equipment, manpower, as Dr. Debashish rightly pointed out, the goodwill which we have created amongst our patients, and of course, our focus of what we really want to achieve. Coming to the infrastructure, the physical structure or the ambience needs to be maintained. And essentially, we are looking at the first top three senses. That is, for the site, we need to maintain a clean ambience or an infrastructure. We prefer to have a good, bright, well-lit atmosphere. And we can make it more pleasant by having paintings and maybe a television to keep the people occupied while they are sitting in the waiting room. However, I do not like the sound to be on. We keep the TV on mute, and hence usually prefer to have silent movies like Charlie Chaplin running on the television. And we complement it with actually a soft instrumental music in the waiting room. For the smell, we prefer to have the automatic fragrance dispensers which are readily available now, and without much intervention, help create a good atmosphere. Also, what is important is that the maintenance of this infrastructure is an ongoing process, and hence there should be a team member or a manager who is responsible for maintaining this. And with responsibility, they should also have some power to go ahead and conduct minor repairs without having to disturb us or even take a permission from us. What we would need to do is just take frequent rounds of the facility with this team member to ensure that everything is in place as per the goals of the organization. And it is often a good option to have a civil contractor with whom we have tied up, who is a regular person who takes care of all the civil aspects of the facility. And being eye doctors, it often helps to have some kind of civil contractors who are patients themselves or their family members and are ready to come and help us out immediately when at just one single call, so that we can maintain our infrastructure to the level which is required by the patient. Regulatory compliance is also required to be maintained. This would depend upon the type of organization. But nursing home registration, fire NOC, and biomedical waste are something which is important, and NABH guideline often helps us to streamline this process. Again, financial compliance needs to be maintained. And again, depending upon the size of the organization, a lot of things will increase. A big size organization, besides taking care of income tax and TDS, will also require professional tax for all the staff, provident fund, and GST if we are going into the optical business, optical services like spectacles or the pharmacy. When we are talking about maintenance of the equipment, we need to ensure that our medical and non-medical equipments are fully functional. Again, we need to train the manpower on instrument handling so that each and every instrument has a longer life and are well maintained. And looking at the overall financial project, one will have to think about going for CMC or AMC for all the medical equipment, looking at insurance policy for all the equipments, and having a regular preventive maintenance system so that the downtime of the equipment is reduced. Because remember, a non-functioning equipment provides a false sense of security and are actually a liability, and we will end up trying to save face from the patients when we actually need that equipment the most. Manpower maintenance is the most important pillar because the manpower is what projects the organization to the patients. It takes a lot of effort to create teams, and equal amount should be taken to ensure that the team is not broken. Regular interaction with the team members at all levels and training on the go are important aspects which help improve the performance of the team members and also ensures employee satisfaction. Remember that aligning the staff with the long-term goal of the organization helps retain the priceless ones. How do we maintain the goodwill of the organization? Remember that in healthcare, word of mouth publicity is the best publicity, and a goodwill may be difficult to earn but very easy to lose, especially in this era of online reviews in form of Google review and Practo review. And hence one should ensure that the whole team is aligned to providing service to the most important person, that is the patient. Never lose focus in all this about what we and our organization stand for, and often discuss this with all the team members. So if the focus is to provide great service to the patients, let this be discussed and talked about amongst all the team members. Coming to the second aspect of consumables, a detailed knowledge of consumables is important to align the consumables with our goals, to align them with the patient needs, to plan various surgical packages, to plan which medical equipment needs to be purchased. And with respect to consumables, we need to set up again teams which help with the procurement of the consumables. Now, first and foremost, with respect to consumables, we need to evaluate regarding all the consumables, whether the cost justifies the scientific and service goals of the organization. Yes, definitely, as a doctor, using various consumable helps in improving our clinical experience and the joy of working. But we also need to remember the patient's point of view. Patients often read up about various options, like various different intraocular lenses or surgical techniques, which are often marketed. And patients should have the option of choosing what they want and pay the relevant charges. Having multiple options in terms of consumable helps to convert these patients into patients who would undergo the surgery if we can offer them what they really want. And also in this way, organization spends only on what the patient is ready for. For doing this, we need to create various packages. Patient gets the option to choose whichever package they want based on what is there in those packages. And because the patient is paying by choosing what package they want, the organization spends for consumables based on what the patient decides and pays for. Also, the consumables are linked to the equipment purchase as a whole, because consumables play an important role in overall profitability and the break-even calculation. So careful planning and calculation should be done based on the workload, a demand for a particular machine. And remember that higher the volume, more is the burden of the non-reusable consumables. And hence we often see that in charitable hospitals, they often buy machines which have reusable cassettes. So all this needs to be kept in mind. Also for day-to-day consumables like cassettes, intraocular lenses, and other systems, we need to set up teams and set up automatic procurement, whereby as soon as there is a case which requires a given consumable, it is ordered. Or let's say for a retina setup, if the stock of silicon oil goes below a certain level, then it is automatically reordered. And this can be done by manually scrutinizing a stock register regularly, or having a inventory software which can do this automatically. Coming to the last topic of controlling the outgoings. Do we really need to control the outgoings? Remember, when thinking about outgoings, is that outgoings are an integral part of growth. As we talked about the consumables, when the proper planning of packages is done to align the cost of consumables to what the patient is paying, we really need not bother about this, because whatever consumable is going as an outgoing expense, correspondingly the patient is paying for that. But overall outgoings such as rent, EMI on equipment, marketing expenses are necessary, and one needs a proper planning with respect to this. Because remember, letting the things flow, being positive, allows more things to come. So to summarize, maintenance of all the aspects is important for the growth of the organization. Consumables, if we provide what the patient wants and has paid for while looking at the long-term goals of the organization, it does not remain a stress factor. And for regarding outgoings, we should reduce wastage definitely, but do not try to control outgoings, because calculated more the outgoings, more will be the incomings. Thank you very much.
Thank you, Dr. Gaurav Shah. I think very important point which you have covered right now as far as the outgoing is concerned, that what we really need to do is to stop the wastage. In a recent scenario, if we see the COVID vaccination situation, there is so much of wastage. Probably this is something which Corona has taught us how to control the wastage in the outgoings. With this, we now invite the next speaker, Dr. Tarjani Dave. She will cover up both the topics for Dr. Vivek Dave as well as for herself. Dr. Vivek Dave's topic is balance between personal life and the practice life. And she will also be covering her own topic of economic versus academic growth. Over to you, Tarjani.
Thank you, Dr. Shah, and thank you, Dr. Senthil, for having me. Are my slides visible and am I clearly audible?
Yes.
All right. So, hello everyone, I'm Tarjani. I work at LV Prasad Eye Institute as a faculty in the Ophthalmic Plastic Surgery Service. And I have this opportunity to talk to you on academic versus economic growth. So in my early career, I took the road less traveled, went towards the academic stream, and I'm going to sort of tilt the balance towards the academic side and give you an idea of what I think works well in both the situations. I will also highlight certain points related to both the mechanisms of growth, whether academic or economic, and bring out things in perspective of what are the similarities and differences in both these streams of growth, the timelines that sort of give you an achievable metric the training that is required for both these streams, what are the catalysts for change in these scenarios, how collaborations and networking help you, and at the end, what next. So eventually I'll be summarizing all of these with you with 10 points that I'm going to list out in this presentation. So what exactly do we mean by academic growth? In ophthalmology, since we all belong to a common platform, let's talk about academic growth. So something that relates to ophthalmology would be possibly reaching the level of, say, for example, editor IJO or editorial board of one of the major peer-reviewed journals that are available internationally. So that is what you would give as a sort of a, picture of academic growth. And if you look at an institute that sort of garners this kind of culture, this is a picture from the website, which will tell you about the several different things that happen when a person chooses an academic stream, such as publishing a book or certain named awards coming your way, editorial memberships coming your way, so on and so forth. Versus that, what is economic growth? So again, limiting ourselves to ophthalmology, when we are fortunate to be in a surgical field, which can be very rewarding as far as economic growth is concerned. And if you typically look at a website of an institution which is centered on economic growth, you'd see something like this: a large number of patients seen, a large number of doctors on board, a large number of centers, and eventually a large earning that comes up along the way. So essentially, are these two different? To a certain extent, yes. But economic growth is always sort of, should be considered as a smaller part of your overall or achievements or of your overall academic growth, because a sound knowledge is extremely important no matter which field you want to keep yourself in. So keeping abreast with scientific knowledge cannot be underestimated at all. It is the fundamental resource which helps you garner technological change. And eventually, it's this technological change which is going to take you to a much higher economic growth. So let's look at certain similarities and differences between the two. So here on your left-hand side, you see the circle that typically involves an academic growth. So what is that essentially do you want to do? You want to contribute to science. How can you do that? You need to be very methodical in how and which way you want to contribute to science. You need to look beyond yourself and focus on getting a scientific question that you can answer by searching for gaps in literature. And you definitely need dedicated time. You cannot be bringing up a practice and simultaneously be doing very effective academics. You can do both to a certain extent, but both of them will be at a sort of a mediocre level. For this, again, you need a volume of patients. So it's not that, if you are in a setup where you do not have a volume and you're only pursuing academics, it's going to work out. You need that patient volume to test your hypothesis. And finally, a good scientific knowledge, all of which packaged together will help you advance your science and contribute to science at large. Versus this, when you look at an economic practice model, you essentially are centered on building your practice. Again, you need to be very methodical, but the focus is on yourself in the beginning and on the patient that you want to treat. So that changes your focus a little bit in the economic model. You need to create a name or a brand value for yourself, which again requires dedicated time. You again need to build a volume of patients so that it takes you to a higher economic height. You need to have multiple collaborations that will sort of, fast track your success, build and maintain that volume, which eventually will keep pooling into building your practice and your name. So they have many similarities, so to speak, but there are certain differences. So let's look briefly at the differences. In a research or an academic practice, you will have to look beyond yourself. Probably your name might not be as prominent as the institute you work for or the research that you have put forward. Now, this is two ways. If you have done real good quality research, eventually your name will also get recognition. But it is probably not seen in one of the very glamorous roles in ophthalmology, so to say. your basic ethos changes, where you're actually searching for gaps in literature and you're filling that with sound scientific knowledge to eventually advance science. Versus that, if you look at an economic model, the focus is very much on yourself, your practice, and your patient. So it's you-centered sort of a thing, with your patient in that circle. It's also, you're trying to create a brand name there for yourself, and you're not looking specifically at literature. You will have to put in a little bit of frugality in the beginning to make sure that you build a large volume practice which is successful and which gives you enormous economic returns. So let's look at the time taken to reach your destination for both of these sort of career paths. So if you look at, again, on your left-hand side, the academic module, then understanding what topic to start research on and developing a focus area itself takes time, and that's your initial 1 or 2 years of practice. And from there to absolutely be an established name in your niche area takes another 3 to 4 years. So your initial 5 years of practice have only gone in developing a research idea and working around it. And this is the time you start getting some amount of national acclaim as well, due to the presentations that you make on several national fora. International acclaim takes a little longer. You take about 7 to 10 years to reach that phase, and eventually to reach the stage of starting to receive awards, honors, and recognition within international and national scientific bodies is around 5 to 7 years. And then the next stage of receiving government and other NGO awards, say the Shanti Swarup Bhatnagar Award or something like that, takes about 15 years from the start of your career. Now, if you compare this to the economic model, then there building your setup takes you the initial 2 years, and then building your name takes about 5 years for you to be known in the local community. National acclaim, international acclaim, awards, honors, and government awards sort of are a little delayed if you are in the economic model versus the academic model. Having spoken about certain similarities, differences, and timelines, let's talk about the monetary gain. So obviously, since as the name goes, the economic model is the one where you are going to be actually achieving much more in terms of remuneration, or in terms of your bank balance at a much faster rate than the academic path. But then there are again points related to how much is your expectation, and how much of comparison do you make between the money you make and the name that you get. That plays a very important role and is a very individual thing as far as people are concerned. What is the background training needed for this? So for any academic growth, you need to have solid residency training supplemented with a good amount of subspecialty knowledge. Whether that is in the form of formal training or not remains debatable. You need to develop a niche area. You begin with diffuse research and then put yourself into very focused research to question the dogmas that are existent. Versus that, in economic growth, what you're going to do is, as far as training is concerned, is sort of look at being practice ready by the time you have finished your residency. Possibly get in a little bit of fellowship training, national and international, because that has a brand value itself. Develop yourself into either a group practice or join a corporate or have your own solo practice. So that is the sort of training that you are looking at in both these models. I'll be taking both the presentations together. I'm reaching the end of the time. The second one is a little short, so I guess we'll just continue. Looking at catalysts for both these models. So what is it that works? One thing that works in the academic model is motivation. You have to be motivated to make yourself available for your research and to keep going despite not reaching the end of your logical research on many attempts. Certain things that help are joining societies like the young ophthalmology societies across the world, where again, there are many ophthalmologists like-minded who want to get into academic models as well. Learn from peers who are into a similar path and relate and bond with them, and basically be at a place that has a culture for research, so that everyone around you seems to be doing the same thing, and that somehow tends to put you at ease. You need to build a close circle of friends who are like-minded and are going to be with you and are going to bring you up when you are down. And again, you need a lot of research ideas. And one thing that works is to learn from the questions that get asked by your fellows and residents. Those are excellent beginning points for research. When you look at catalysts for economic growth, there is a lot of networking that you need to do to develop your practice. You need to have several accreditations in place so that patients come to you. You have to have a work culture within your organization. You need to have a good website which people refer to and turn up to you. And you essentially need to become a local celebrity in your region so that you garner a large number of patients. Collaborating with bodies such as Rotary and Lions, as earlier mentioned, also helps. What are the other collaborations that can work? So you have several leadership development programs that can help you work on your research ideas, such as AIOS has one, and there are several other bodies that have their own leadership development programs that can help you. International short sabbaticals after passing your ICO or going for a 3-month fellowship sort of tends to work. It generates new ideas within you because you meet different people. Getting into actively reviewing manuscripts for a journal helps you build a scientific mind to eventually editorial boards, which will make you
Continue, go ahead.
Impactful collaboration with different people across the globe. And eventually you want this to go into translational research from the clinic to the bedside of the patient, so that you have made a difference in the management of a particular disorder. And you would also have to have certain amount of presence at national and international meetings to sort of continuously upgrade your scientific knowledge. When you look at the economic stream, you need to become a leader at the local level. It can be via various means and ways that have already been highlighted earlier. Electronic content release is one very powerful model these days, such as in the work from home culture. If you made a short video on how to avoid computer vision syndrome, it becomes a huge hit and can become viral and can help garner a lot of patients towards your organization. You need to bond with insurance agencies and TPAs to get in more number of patients, and also try to get into certain governmental schemes, corporate checkups. Opticals and pharmacy become a large source of revenue generation for nearly anybody who's in practice. And again, in this model also, since you want to become, a local, regional, national hero, you need to be present at national and international meetings. And the last slide on what next. So I purposefully put this as just a picture. There are several roads that you can take. These roads also intersect at multiple places. It's not that once you've gone into one stream, you cannot go into another stream. Things can always change. Your career path can always change. From a research-centered practice, you might want to get into some roles of leadership over a period of time, and vice versa. So these are things that will keep evolving as you go ahead. Thank you so much for your time. And I'll, in a view of time, move on straight to the next topic, which was on work-life balance. I have a few slides where I'm just going to give an introduction, and then a couple of questions that I'm going to ask all the panelists listed out here. So unlike a balance, this is actually a very close network which is linked to multiple things in your life, your career, your family, and everything sort of tends to come at the same time. For men as well as for women, and there is a minority of women here today, but nonetheless, where things become very difficult and challenging because your career path and your reproductive path are nearly running parallel. So what is the most important thing? Well, the most important thing is managing your time well, so that you have a great work-life balance. And these are 5 things that in my mind sort of appeal to me when I think of work-life balance. The first is to examine your own situation. Not everybody will be in the same sort of situation. The amount of house help you might have might vary. The sort of families you are in might vary. So examine what is your situation, and then what are the most important values that to you and how you want to spend your time. Based on that, try to get everything else converge onto your values and what works for you most importantly. The second thing that you require is to also manage other people's expectations. You are in a social circle, you're in a family where many people would have expectations from you. And it is important to be a part of their expectations and try and manage them to the best of your capacity. I cannot undermine the effect of managing your health, because this is one of the most important things, not only in the chemicals that are released in your brain when you're healthy, but regular exercising, taking your time off, making sure that you are doing things that make you happy, such as meditation or say a trek on a mountain or whatever it might be. This goes a long way in maintaining sanity. At certain times you need to learn how to say no, whether it is for your work or whether it is for your family, and that clarity in mind should be there without any conflicts, so that you are not in a dilemma and you're not worrying about a problem once the problem has been tackled. Also, you need to at some point of time invest time in some amount of fun activities that keep you going. So with this, if Dr. Debashish could take up this question. So this question, sir, for you is, how do you manage your calendar and schedule, being at a place like Disha, where you would be very, very busy in managing the large amount of HR that you mentioned? How do you manage your calendar to make sure that you have a good work-life balance?
See, I work 9 hours a day. I can't work more than that. So essentially, I have 4 clinical days and 2 administrative days. And 1 day is for me and my family. So essentially, that's how I work. Of course, I don't look after HR. Yogesh gave me the topic, so I had to talk. But essentially, I'm more of in a strategic role. So essentially, in Disha, it is a big organization. We see 12 lakh paid patients and do about more than 1 lakh of surgeries. But then over the years, this has happened. So it is compartmentalized, and I think things are in position and they keep on working.
Right. So those were some excellent tips. If I could just reiterate, compartmentalizing, dedicating days for work and administration, as well as for one's own self, sort of go a long way in keeping things on track. Thank you for that, sir. So this one is for Dr. Senthil. And the question I have for you, sir, is that many times we say that good is the enemy for perfect. And we try to achieve perfectionism in a lot of things that we tend to do. And that takes away. Okay, if Dr. Senthil is not here, probably Dr.
I'm here. I will take the
Okay.
Yeah. So how do you go about that? Perfectionism takes a lot of your time, and many times we just refuse to settle for something that is good enough. So what would be your take on this?
I think in India, the biggest problem is achieving this perfectionism, because most of the time the employees are not tuned towards doing that 100% clear work. Let's say you go to the Europe, so you see a wall which is very cleanly plastered, but in India you don't see that perfectionism. So when you want to achieve that, so first thing is to understand the reality. So things may not be as perfect as you actually wish to. So maybe you should settle for, if you're aiming 100, maybe even if you get 98, you should be okay. The second way is basically you do things on your own and train those employees to do that. I think that is the other way. Otherwise, they don't understand what is your expectation, because it's important to make them understand what is the expectation we have. And maybe there are situations where you have to do that yourself and then show them so that they do that. That's the only way.
Right. Thank you very much, Dr. Senthil.
We have 2 more minutes.
Yes. So just quickly going through, Dr. Gaurav Shah, if you could tell us how you decide on unplugging from the normal chores of the day and to break free, your inputs on this.
For me, meditation and spirituality has been a big help, and I regularly plan my times off from the clinic, where I can go and be undisturbed and be with my own thoughts, or let's say silence my thoughts actually, so that I can reconnect with my own self, and that has helped me a lot.
Perfect. Thank you so much, Dr. Gaurav Shah. And probably the last question for Dr. Yogeshan, how you plan on having family balance? So in your earlier years, when you had 2 young children, how did you manage it?
I think that time was a quite difficult time, and I must say and admit that it quite a lot depends upon your spouse as well. Just to brief you, I had almost about 20 attachments at a given point of time. I was attending 20 different hospitals within a week's time. And at that point of time, you need to have a spouse also. But at the end of it, you also have to select a time out for the family, and don't consider only those 20 attachments which you have. Consider 21st attachment as well. And I think in a long run, that always pays, because you also become a fresh person spending a quality time with your family. So you always need to, and that is what I did, in fact, actually, that even if I had to go out, I would take my family also along with me, so that while working also, I do find some time, whatever time is available to me. And that is the way you can make best use of your quality time also. So I think because time is short, we will possibly end our this thing here. We will not have any further question answers because it's already 2:15, and that was the time which was allotted to us. Thank you very much, Dr. Senthil, Dr. Debashish ji, Dr. Gaurav Shah, and Dr. Tajani. All of you did extremely well, and I'm sure this instruction course must have benefited not only the people who are going to start with their practice, but also those who are already in the practice, and especially those where both husband and wife are in the same profession, and both of them have to spend a lot of time with their academic as well as the clinical work, how to make best use of it and devote certain time to their family also. We have tried to cover a large number of points in this instruction course. Thank you once again, everyone. And I take this opportunity to thank All India Ophthalmological Society, Secretary Dr. Namrata, outgoing President Dr. Maipal, and incoming President Dr. B.K. Nair. Thank you all. Thanks a lot.
Thank you, Yogesh. Thank you.
Thank you, sir.